Welcome to this afternoon's session on the Strengthened Aged Care Quality Standards. My name is Lisa Peterson. I'm Deputy Commissioner for Sector Capability and Regulatory Strategy at the Commission. Thanks so much for coming along. It's great to see so many of you here and the people that are joining us online. We know you're very busy people, so we really appreciate you being part of this. I'm going to start us off with a presentation. I've got about 30 minutes of content to unload, and through that I'm going to start off by talking about the changes to the aged care quality standards and where we think providers might like to focus in terms of getting ready for those changes. I'm going to talk about the role of audit in the new regulatory framework, and I want to highlight some of the important changes to our audit process and talk about what you can expect from us. I'm also going to take you through our evidence mapping framework, which outlines how we're going to be assessing conformance against the strengthened standards. And then we'll have an hour for Q&A, and I really want that to be lively, so please start sending your questions through. And we have a great panel joining us for the Q&A session. We've got some subject matter experts from the Commission, we've got a rep from the Department of Health and Aged Care, and we've got David Moran from Southern Cross Care. So, to start us off, I want to share with you what you've told us about your readiness for the strengthened standard, and thanks to everybody that participated in our pre-conference poll. So we can see that most people are on a journey to understanding the standards but would like to know more, and there's a really healthy chunk of around 20% who are all over the detail. We see a similar picture on provider readiness, so the majority are on the way with more to do, and again a really good sized group who feel confident about where they're going to land. And we're absolutely delighted to see that a very sizable majority are using the Commission's resource pack to help them get ready. So really exciting to see such a high level of engagement from providers around the strengthened standards as we go into the discussion this afternoon. So the standards are the promise that we make as a community to what older people can expect from their experience of care. So right at the core of trust and confidence in aged care. And older people tell us that great care is personal, respectful and kind. Great care is built on an understanding of the older person, who they are, their identity, beliefs, ability, diversity and care experiences. And great care means clear communication and a partnership with the older person, where they have choice and support to make the decisions that they want to. And great care is adaptive. It's receptive to the needs and preferences of older people as they change over time. And great care enables older people to live the life that they choose with dignity and respect. Great aged care starts with great leadership and strong corporate, financial and clinical governance. And great care is transparent, with a strong culture of open disclosure where mistakes are acknowledged and learned from. And great care needs great aged care workers with the right skills and behaviours, supported through a positive workplace culture that values learning opportunities to build continuous improvement. And great care is connected with all of the people and services that contribute to the care of an older person. So these are the themes of the strengthened standards, and there's nothing here I think that will be unfamiliar to you. But what you will find is there's a much more explicit and detailed articulation of what we expect to see in safe, high-quality care. I'm going to take a little bit of time to talk about some of the key features of the strengthened standards that you might find useful to think about in thinking about your own readiness for the strengthened standards. And those of you that joined us at last year's conference might remember that we presented our analysis of the change impacts and the change components of the strengthened standards compared to the current standards. So we've updated that document to align with the most recent version of the strengthened standards, which was published by the Department in December, alongside the exposure draft of the new Aged Care Act. And that document shows us that around 13% of requirements of the strengthened standards are new expectations, 63% are clarifying current expectations, and around 24% aligned to current requirements and legislation. And while the new requirements are clearly very important, it is worth paying attention to where we've clarified expectations, because again, you'll find that we're much more explicit. If you're a demon for detail, you will enjoy the 140-ish pages where we go through every outcome and action in the strengthened standards and articulate the nature of the change. But for those of you that would like something a bit more high level, just this week we've published a summary document for each of the standards. It's 3 pages, and what we do there is call out some of the key themes and where we think providers will be interested to pay attention. I'm going to take you through that now. So for Standard 1, you'll find an increased focus on person-centred care, which of course is reinforced across all of the standards. So this is about how you and your staff plan and deliver and evaluate the care and services you provide to older people. And most importantly, it's care that's respectful of and responsive to the preference and needs and values of the older person. We're looking for a partnership between you and the older person and their family and carers. And diversity and dementia care were 2 of the 5 issues called out by the Royal Commission for greater attention in the strengthened standards. And you'll find clearer requirements to implement strategies to identify an older person's background, culture, diversity and beliefs. And there's also a requirement to deliver care that's culturally safe, trauma-aware and healing-informed. You'll find transparency as a key theme here and throughout the standards, and including supporting older people to understand their agreements. So on to Standard 2. Governance is yet another focus area called out by the Royal Commission, and the strengthened standards have a really strong focus on your strategic settings and systems, and providers need to be able to show how they're managing the specific requirements of the standards systemically. When we talk about systems, what I mean is a way of working, organising or doing that follows a plan or a set of rules or processes. It doesn't have to mean an ICT system. The systems that we're looking for direct and control how you deliver quality care. So, for example, your end-to-end risk identification and management systems or your incident response systems. We want to see systems that support great care because we want to be assured that the practice of great care is repeatable and embedded throughout the organisation and not reliant on the good work of certain individuals. And as we all know, monitoring and reviewing and continuously improving systems and processes is really pivotal to delivering safe, high-quality care and, of course, the improvement of care over time. So you can expect us to be interested in how providers are monitoring and reviewing and improving all of the outcomes across the standards. And we want to see how your systems and processes lead to positive outcomes for older people. So, for example, partnering with older people. This has got to be more than just speaking with an older person about their care plan. It includes all of the actions that you take right throughout your organisation to support partnerships with the people you care for, how you assess whether you're doing that well, and what you're doing to continuously improve. And this includes where things go wrong, where we expect you to practice open disclosure and communicate with older people and their families and carers, and also your workforce. And we heard from the Commissioner earlier this morning about this. We want providers to clearly show how they remedy or understand and fix the problem. We want them to partner with older people and restore trust and to prevent the situation from happening again. So, for example, we'll want to see where you've resolved complaints using open disclosure processes. And we've talked a lot about the concept of open disclosure over the last couple of years, both in relation to complaints and incident reportings, and we're keen to see this embedded in your culture and systems. And this will be a really important part of getting ready for the new Aged Care Act and a rights-based approach to delivering aged care. Standard 3 tells us how providers must deliver care and services to the older people that they care for. And this includes ensuring effective assessment, planning, coordination and communicating their care. And each of these elements should be tailored to the older person's needs and goals and preferences. And all of this is built around a strong, capable and supported workforce. In Standard 3, you'll find some new actions, one that relates to caring with people with dementia, to encourage them to use their skills and strengths. And there's a new action around aligning care and services around people's needs. Standard 3 also strengthens the requirements around handover of care between workers and others and draws attention to regular review arrangements where there are transitions of care. In Standard 4, you'll see much of what is in current Standard 5 relating to the physical environment and equipment, and this standard ensures that older people receive care and services in a safe environment with the necessary supports to meet their needs. You'll find that there's a stronger emphasis on environmental risk assessments. This standard also includes outcomes related to the equipment and aids that you provide for the people that you care for, which is consistent with Standard 4. And it also incorporates infection prevention and control as a core part of service delivery to protect older people and their families and carers and workers. Clinical care is another of the 5 areas identified by the Royal Commission for greater focus and now has a dedicated standard. And I think we all know the importance of good clinical care in enhancing quality of life and reablement for older people. There are now dedicated outcomes for clinical governance, the safe and quality use of medicines, caring for people with cognitive impairment and clinical safety. So, for example, in outcome 5.5, we see specific actions related to choking and swallowing, continence, falls and mobility, nutrition and hydration, mental health, oral health, pain, pressure injury and wounds, and sensory impairment. And providers are expected to regularly review and improve the effectiveness of their systems and processes for clinical safety. Standard 6, food and nutrition. So this is the 5th area of focus identified by the Royal Commission, and we now have a dedicated standard for residential aged care. And the big change here is really better recognition of the importance of food and the dining experience to quality of life. And older people tell us that this is one of the most important aspects of their care experience. So there's a real emphasis on improving choice, what and when to eat and drink, and providing access to food and drink all the time. There's a greater focus on the experience of dining, so making sure that it's enjoyable and provides opportunity for social connections. And this has been an area of focus for the Commission for quite some time. We now have a food, nutrition and dining advisory support unit and a hotline to help providers to deliver higher quality and more nutritious meals to older people in a way that works for them. You can find all sorts of resources on our website, and we've just opened for expressions of interest for our free menu and mealtime review program. So take a look at that. Of course, providers delivering services such as domestic assistance and Meals on Wheels or assistance with care and housing aren't subject to the quality standards, but they will be subject to other provider obligations under the Aged Care Act. Standard 7 is all about ensuring that the older people that you care for in the residential community have a sense of safety and well-being, including support to continue their personal and cultural connections. And the theme of diversity is really important here, with a focus on respect and recognising and valuing culture and background and experience as a really important part of making people feel at home where they live. And Standard 7 also considers transitions in care, which is a new theme in the strengthened standards. So the goal here is well-managed continuity of care when an older person leaves their residential care community, for example, to go to hospital or returns. So I hope that gives you a bit of a sense of where we're heading with the strengthened standards. And for a really detailed picture of what we expect, please take a look at our draft guidance documents, which are available on our website. We've published a separate document for each standard that explains your obligations and the practical steps that you can take to meet the outcomes of the standards. And of course, how you apply that guidance is really going to depend on the circumstances of your service and the needs of people that you care for. Where we think there are different expectations for residential and other categories, we have included content that is specific to service type in the guidance. So this is something we're really keen to hear back from you on, about whether we've done that well enough. And you'll see that we're also including content that's specific to roles. So content for governing bodies, for providers, and for workers. We've also published a separate document for aged care workers, which is really intended to bring the standards to life in a really simple way and give some really practical examples of the sorts of actions and behaviours that are important in the way that workers deliver their care. So a big thank you to all of the providers that have helped us to prepare those draft resources and everyone that's participated in our roundtables or provided feedback online. We will be updating all of the guidance based on the feedback through the consultation process that's running through till the end of April, and I'll have a bit more to say about some of the other documents on the slide as we go through the presentation. I want to take us now to how we'll be assessing performance against the standards under the new regulatory framework. So the purpose of audit under the new reg framework is to inform registration and registration renewal decisions, and importantly, to promote continuous improvement. And as you heard from the sessions before lunch, audit won't be the only factor that drives registration decisions. As you've heard, we'll also be drawing on all the other intelligence and data that we hold to understand provider performance. If we find risk through an audit process, we won't walk past it, but we'll initiate a response to that through our risk-based surveillance and monitoring program, which is our primary tool for identifying and responding to risk. So I know you've had a huge amount of detail on registration in the session before lunch, but I thought it might be worth just doing a 30-second recap of the different registration categories. So just a quick reminder that the standards that apply are not the same for everyone, but will depend on your registration category, and you can see which standards apply in the right-hand column on the slide. So the basic rule is that if the standards don't apply, there's no audit. If you deliver a combination of services, an audit will include only those services to which the standards apply. And audits are at the provider level. So in categories 4 and 5, we'll collect provider level information once, and then we'll use a sampling approach to evaluate care and services to older people at the service level. For Resi, again, we collect provider level information once, but we'll audit every residential care home, and all audit outcomes will inform those registration and registration renewal decisions. Next, I want to take you to our audit methodology, and I thought I'd start by sharing with you some of the outcomes of our pilot audit program that we ran over 2023. You might have already heard about this. We did a pilot, 40 audits across 32 providers, and we had Resi and home and community care. We had services in metro, regional, remote and very remote. We had small and large, and we had services that provided diverse communities and specialisations of needs of people receiving care. And thank you to everybody that participated in that program. So the purpose of the pilot was to test the draft strengthened standards and our audit methodology in practice and see if it worked. So we've evaluated the outcomes of that pilot program, including all of the feedback that we heard from participants, and you'll find a report on that on our website. We found that a hybrid approach to audit, combining off-site and on-site activity, was the most efficient and effective audit model, with on-site activities beginning with the request for information step at the beginning of the audit. We tried gathering evidence at the action level, but we soon found that this approach resulted in duplication and inefficiencies. So we're now assessing evidence at the outcome level, and audit findings will be made for each outcome within each standard and for each standard. We trialled a new streamlined format for audit reports, and we captured the detailed evidence to support audit findings in an online digital audit tool which providers could also access. And we found that that supported effective decision making, and providers really liked the transparency provided by that digital audit tool. We did find that the pilot audits required more time and effort for both auditors and for providers compared with our current quality assessments. And I think that was largely due to the need for additional time to understand and apply the strengthened standards. We found towards the end of the program that those timeframes were improving. We also found that the increased detail in the strengthened standards impacted on the efficiency of the pilot audits as well as the auditability, and there were multiple instances of where outcomes and actions in the strengthened standards were duplicated. So we provided all of that feedback to the department, and they took all that on board, and that has been reflected in the version of the strengthened standards that was published in December. Our intention when we designed the new audit methodology was to develop a framework that supports consistent, accurate, efficient audit outcomes. And we found that around 80% of providers and auditors said yes, the audit process supported the accurate assessment of quality of care and services, including identifying any risks to older people. Importantly, the audits provided consistent and accurate audit outcomes for the same providers, even when undertaken by different audit teams. So we were thrilled with that. Feedback from from our auditors indicated that smaller and newer providers were more challenging to audit due to their resource constraints and perhaps also a lack of clear expectations about what we wanted to see under the strengthened standards. So we're hoping that our guidance documents will go some way to resolving that issue. We found that our sampling approach for engaging with older people for category 4 and 5 didn't work well, so we've improved that by ensuring that that's something that we talk about with the provider right at the very beginning of the audit process. And we're also ensuring that the timeframes for audit give the providers time to inform older people about the audit to ensure that there can be meaningful engagement for our audit team and collection of evidence. Providers have suggested that we combine our request for information tool and pre-audit preparation tool into one to reduce duplication. So that's something that we're having a look at. So we've taken on board all of the learnings from the pilot program, and what we've done is make some adjustments to our audit methodology, and now we're trialling it again through a program of trial audits that's underway right now. What I can tell you about that is that providers are very positive about having provider information collected once, and I think that's particularly for those larger providers with multiple services. Providers tell us that they would like more information to support them to prepare the request for information and to engage with us effectively at the provider and board and senior management meetings, so we'll be looking at that. Providers tell us that there is room to further streamline our evidence mapping framework to reduce duplication and repetitiveness in our interview questions and document requests, so we're taking that on board. Providers also told us that the new format of our audit reports, both the preliminary and the final, is clearer and easier to read and respond to, so that was good news. Another key finding from this work is that we need to consider the context and the challenges of delivering care in remote areas and for NATSI services more actively in our approach to audit. And that means for us a greater focus on outcomes, recognising that the how might be different to what we see in mainstream services. And we also found that we need to provide better training for our audit teams around how they should approach audit for NATSI services to ensure that our assessments are fair and properly considering cultural context. And we take that seriously, and that work is underway. I do want to be clear that we don't ever want to assume that people should get a lower standard of care because of where they live or because of their culture. But what we do need to recognise is that safe, high-quality care will look different for older people in different circumstances and different services. And our focus needs to be on understanding what does great age care look like in that circumstance, and is that what we can see? A couple of new features of our audit methodology that I want to talk about, and you heard a bit about this earlier at the registration session. Firstly, and most importantly, our focus for audit is to form a view of the provider, rather than just considering performance at the service level. And this is essential under the future state regulatory framework, as you heard, because registration happens at the provider level. And our current audit programs for both residential and home care have a service level focus. And actually the current legislative framework requires a site level audit for the purposes of reaccreditation for residential aged care. There is a bit of flexibility for home service settings where we can do multi-service audits, but this really changes under the new Act, where the framework focuses on a provider's performance in relation to all their care and service delivery across all funded programs. And most of our sector, and this goes back to Janet's observations this morning in her keynote, we've got a lot of providers that deliver multiple services. In residential aged care, multi-service providers account for about 80% of services, and we know that many of you deliver multiple care types. So there's a real opportunity, I think, for us here. If we can drive continuous improvement at the provider level, we can really maximise capability uplift across the sector. So our audit methodology, as I've said, focuses on understanding the provider as well as getting a view of how care is delivered at the service level. And there are a number of different process steps, so let me get into that. So we'll start with contacting the provider to initiate the renewal of registration process. So we'll advise you when you must submit your registration renewal application, and this will also commence the process of audit where audit's required for registration renewal. So the audit process begins with a request from the Commission for providers to complete the pre-audit preparation tool and the request for information tool. And the intent of these tools is to allow the Commission to gather as much information as we can for off-site review. And getting this information up front in the audit process also means that our audit teams will have a really good understanding of the provider before they get on site. And it also helps us to focus our on-site activities. As we've mentioned, both of these documents are currently out for public consultation. We've heard the message about combining them, so we anticipate some further changes before these are finalised. So after we've sent you the RFI and you've responded, we'll then have an opening meeting with the provider and key service personnel where we'll take you through the audit process and sense check our understanding of the information that you've provided to us, and we'll arrange the scheduling of interviews. A really important new step is that we will meet with the provider's governing body and senior management team, and this is part of our evidence gathering process around provider governance. But importantly, it gives governing bodies a chance to talk to us about the things that you would like us to understand about you. So it might be that you want to tell us about things that are going well, innovative care practices, but you might also want to raise some of the issues and challenges that you're facing and risks and how those are being managed. So after that, the next step is our site visit, and this is mandatory for all residential services and Category 4 services where respite care is delivered in an environment such as a respite centre. And I'll say a little bit more about evidence gathering as we go. And then we'll hold a closing meeting with you and discuss our initial findings. So where our team identify risk or issues or likely non-performance, we'll have a chat with you about it. We'll want to understand, are you aware of the issue? Do you know what happened? What's the root cause or the source of the issue? And what actions have you taken already to address the issue and its root cause? And when do you think you might finish that piece of work? So we'll then prepare a preliminary audit report where we'll record the preliminary audit findings and the audit gradings for each outcome and standard and share that with you. And that report is supported by the detailed evidence that we've recorded in that digital audit tool, which providers will also be able to access. We're introducing graded assessment. We're really excited about this. So we're moving from our current binary pass-fail model to a graded assessment model across 4 grades. And graded assessment provides much more transparency on provider performance and we hope will promote continuous improvement. And our auditors will grade both at an outcome level and at a standard level. And the 4 grades will be conformance, so basically we're happy with performance against the standards. Minor non-conformance, so this will be where we can see an opportunity for improvement or we see a gap in your systems and processes, but it's not a systemic issue and it doesn't represent high risk to older people. The next grade is major non-conformance, and this is likely to be where we do find high risks to older people. And a reminder that we expect providers to have those systems in place that support the delivery of care. And you'll need to be able to show us how those systems are implemented and how you monitor and improve those systems. And where you can't demonstrate your systems to provide quality care, that's likely to lead to a finding of major non-conformance. And the 4th grade is exceeding, because we want to recognise when you're fabulous. And we're still working on the framework for that one. So current thinking is that this would be where a provider has achieved conformance against all the standards and can meet some additional criteria. So stand by for more on that. We'll ask you to review that preliminary report and provide a response back to us, including any additional evidence that we should consider, and we ask that you correct any factual inaccuracies in our report. So that's the process. We've got that as a published document right now on our website, and we'll be updating that document to take account of any further tweaks that we make as part of the work that we're doing through our trial audit program and feedback from the public consultation process. One of the things that you won't find in the document right now are timeframes for the different parts of the audit process that I've just described, and that's because we've been gathering evidence to get a good sense of what that should look like. But you can expect when we do republish our audit methodology that we'll include those timeframes for you, so those will be clear. Okay, so we then issue a final report, I should have said, which goes to the Commission delegate who's making the registration renewal decision. I guess the key message that I want to leave you with about these changes to our audit methodology is that what we're trying to do through a number of these steps is to give you, the provider, greater agency in terms of what you put forward to us to help us to understand your organisation and that demonstrates conformance with the standards. Of course, we will identify things that we want to see, absolutely, but we encourage you to think as broadly as you can about what you put in front of us that helps us to understand you and how you deliver care. And that takes me to the very exciting, well, it's very exciting for me, the very exciting topic of our evidence mapping framework. So one of the things that we've heard from you is that transparency around how we understand performance is really important. So we've published our draft evidence mapping framework as part of the resource pack that we currently have out for public consultation. And the primary purpose of the evidence mapping framework is to support our auditors and their evidence gathering process by giving them a standardised set of questions and examples of evidence aligned with each of the evidence categories. But you can use the framework to help you to identify how you'll demonstrate conformance and prepare for audit. The evidence mapping framework is not meant to be an exhaustive list of questions and documents. Rather, it's designed as a guide to support our auditors to identify the most relevant and high-value evidence. And we recognise that the relevance of evidence examples in the framework, again, will really vary, depending on your circumstances, including the needs of people receiving care. And again, we encourage you to provide the audit team with other forms of evidence where you have them. So the evidence mapping framework is structured around key concepts or topics in the strength and quality standards, which we've grouped into 21 themes. And this approach recognises that many of the themes are relevant across multiple outcomes and helps to minimise duplication. And under each theme, we show each of the outcomes and the evidence categories and examples of the sorts of evidence that we'll be looking for. So we gather evidence across a range of categories and sources, and we do that because that helps provide greater certainty and accuracy and reliability in our audit findings. And where that evidence relates to feedback, we've included the sorts of questions that we'd ask your governing body or your workers or providers or older people and their carers. Auditors are encouraged to adjust the wording of those questions where that's needed. And you'll see in the evidence mapping framework that we've identified where we might look for different evidence at the provider and the service level, as where the evidence might be different across different registration categories. So provider level evidence is gathered and considered at all the associated service locations and aged care homes. And the focus of that provider level evidence is understanding the systems and processes, including those for monitoring performance. When we get to service level evidence gathering, we're more focused on testing the implementation of those systems and processes. So this includes understanding the experience of older people and their care outcomes. And where we find that an aged care service implements systems and processes which are different to the providers, then we'll need to assess those, but we're also going to be really interested in why they're different and why the provider processes aren't being used. But when it comes down to it, fundamentally, there are really three overarching questions that we're asking ourselves through the audit process. So firstly, do the providers' systems and processes deliver on the intent of the outcomes within the standard? In other words, is the design of your systems and processes right? The second question that we ask is, can we see those systems and processes implemented in practice? Are they happening on the ground? And to test that, we very much do that through the lens of the older person, but also through the lens of the worker. And the third question that we ask ourselves is, how is the provider monitoring how those systems and processes are applied in practice, assessing how well they work, and making improvements to deliver high quality care? And I must say that across all of the different evidence categories, the older person's experience of care and services and care outcomes are critically important to us. The older person's experience and feedback is vital to understanding whether the systems and processes that you have in place are indeed achieving high quality, safe care. So to close, I want to tell you a bit about what's planned next to support the sector to get ready for the strengthened standards. I've already mentioned that the provider resource pack that we've put out for public consultation, we did that in the first week of Feb, and the consultation period closes at the end of April. We will publish a summary of the feedback and what you tell us, and we'll detail the adjustments that we make to our resources based on what we hear. We're really conscious that the current format of long, wordy documents won't necessarily suit everybody. So we're really delighted to be showcasing an early version of our new digital guidance tool here at the conference, and the beta version has now been published on our website. So the tool provides tailored guidance based on your registration category and your role, governing body, provider or worker. So you enter that content in, and then you can then drill down to see the guidance for each standard and outcome. And we've integrated our evidence mapping framework into the tool, which lets you see the types of evidence that we'll look for against each outcome. And again, a big thank you to those providers that helped us to design and test our new digital guidance tool. Please do have a chat with our guys. You can find them in the main space where you can check it out and tell us what you think. Your feedback is really welcome. We'll also be using this base content to develop learning modules and posters and videos and infographics and storyboards and many other things that you can share with the people that you care for and your workforce. And there'll be presentations and toolkits that your learning and development staff can use to help train your people on the ground. We are really conscious, though, of the importance of tailoring our readiness program to support the diversity of our sector. So we are developing dedicated engagement and education readiness programs for both First Nations and COLD, older people and providers and workers. And through that project, we are co-designing a range of different resources in a variety of formats and languages. And a big thank you to all of the providers and stakeholder groups that are participating in that process. And we really look forward to showing you the results of that work. So we will continue to release products on the broader reg reforms, including the miracle of registration that you heard about earlier today, to inform and support the sector. So we started with the strengthened standards because this is where the policy settings were landed first. But you can expect us to take the same transparent and collaborative approach to helping you get ready as the detail for the other reform elements is settled. So that's it for me. I now am very keen to get into the Q&A session. So I'm hoping that people have been sending through their questions, and it's now time for me to welcome our panellists to the stage. Please come up. So we have Anthony Speed, who's the Executive Director, Quality Assessment and Monitoring with the Commission. Sharayne Givens, Senior Director of Accreditation and Performance. So between them, Anthony and Sharayne manage our accreditation and quality assessment functions. We're delighted to welcome Monique Versace, who's Director, Quality Standards, Choice and Transparency with the Department of Health and Aged Care. And it's really important to have the department here in this conversation because, of course, they are the policy owners for the strengthened standards. And we're really delighted to have David Moran, CEO of Southern Cross Care. So David's been with Southern Cross Care since, I think, 2011, and I think CEO since 2017, and came to that role with decades of experience in retirement living and aged care. And David will be able to speak to the experience of Southern Cross Care as a participant in our pilot program, so I'm sure he will have some terrific insights to share with you. So to submit a question via the conference app, please do go to that session in the schedule and you'll see live Q&A happening now. Click on that banner and you should be able to submit a question. And we also have a couple of microphones in the room, up there and up there, sort of at the, well, for people who want to get their steps up, that's a great way to do it. So let's get into the conversation. I am going to kick off with a question, I think, for Monique. Can feedback be provided on the final draft strengthened standards, and will there be any changes to them after the new Aged Care Act is finalised?
Thanks, Lisa. So the final draft strengthened standards was developed following significant consultation with the sector and older people and incorporated findings of a pilot by the Commission. And we really would like to thank all of you in the audience and all of you listening. We know there was lots of contributions from yourselves as well in relation to this. So the final draft has been approved by government and is being used to translate the strengthened standards into law under the new Aged Care Act. As this drafting process continues, we are only expecting really minor wording adjustments to be made just to ensure the consistency with the language in the legislation. I do want to really assure you, though, that the overarching messaging and expectations of the strengthened standards won't change as part of this process. Additionally, we're also looking at a process to periodically review the strengthened standards every 5 years from their implementation, as recommended by the Royal Commission. We'll use this process to refine and update these standards as needed and ensure they continue to deliver improved outcomes for older people accessing aged care services.
Terrific, thank you. Okay, I can't see any questions on my iPad yet, so I'm just going to ask my crew whether I should be. But in the interim, please, I do encourage you to send them through. But I might ask a question of David, if I may. David, can you tell us about your experience of testing the new audit methodology? What was that like?
Certainly, and thank you everyone for attending and coming from around Australia to Adelaide. So we've had the Fringe and the Gather Round and Live Golf, but we've got the Aged Care Quality and Safety Commission, which trumps a lot. So it's great that you're all here in Adelaide, and we welcome you as an Adelaide person. So yeah, our experience, we were very early on in the piece. So we were probably one of the first, one of our sites was one of the first tested, and it was fascinating because obviously there was the online piece, and then we had board members interviewed as well, and that was really good for them. And probably the assessors, one of the board members they interviewed is kind of Adelaide's most experienced geriatrician, so they got a full blow-by-blow on the work that gets reported to them. So that was probably a different piece, and probably pleased to hear that you're doing that provider thing once when you've got multiple sites. But yeah, so that was also quite new. And then what we did love was the report at the end, the 14 pages, and the last one I read was 100 that we got. So, but really easy to read, very clear, and with the indicators on there as well. It was fantastic to look at. Like, it was just a very easy read, and you know, it had the conformance, and we did have two minor non-conformances, one for the monthly care statement, which didn't exist yet, so we could live with that one, and one we're actually not surprised in any way for that site around a cultural issue. So in that sense, and we did get a feeling that the assessors were probably learning their way through it as well, which is really good that they were able to talk to us about that. So I think the online piece, the interview of the board, and I suppose having that interaction prior to the site audit was different, but it was positive. That was probably our experience out of it. But yeah, it was really good to read the report after and not be buried. It was great.
Well, thanks very much, David. Very reassuring. I hope that is for the crowd as well. So, questions from the room. The most popular question right now, and I think this one might be for you, Anthony. How are you training your assessors, many of whom have no industry or direct care experience, to move away from tick box accreditation and to know what great care looks like?
Thank you, and thank you, Ren, for that question. We invest a lot of time in training our assessors, and we'll continue to do so under the new arrangements. Currently, a quality assessor, in order to undertake that role, must be registered, and to be registered you must complete a mandatory training requirement. You must also meet some other obligations that are mandatory. We have in recent past moved to a very much a competency-based training regime, which I expect will pick up further under the new arrangements that we're currently exploring for auditors to be registered in the New Age Care Act arrangements when they come into play. We have implemented things around coaching to ensure that our assessors have that ongoing access to training and support and mentoring from experienced assessors. And we have also invested heavily as a Commission in clinical standards training. So our clinical unit and areas in the Commission are supporting our assessor workforce through access to that training. And the feedback that we have from those sessions has been overwhelmingly positive. Also positive is when I talk to providers, I hear that those investments that we're making are making a difference, and they are starting to see more consistency of practice. Really heartening to hear David's experience. One of the reasons why we are doing this field testing now is to ensure that, like you, our assessors have been exposed to, trained and familiarised in the new requirements, so that from the commencement of the new Act, we can be confident that what you are seeing as providers is what we expect our auditor workforce to be delivering.
Yeah. I'd like to add too, what we are seeing too in audits is that focus on the resident and asking them and digging in. So that's been, we're seeing a kind of a clear change in that regard, which is really consistent with where the standards are going under the strengthened standards. So, and then the use of data. So actually in the visit we had, and all operators here have their different ways of, and got great systems and others that need improvement, but we have a system called person-centred software, and we really thought that during that visit it was quite golden for that visit in terms of being able to extract data and the trends in that data. So it worked very well for that visit. So that was pleasing as well.
I'd also add, thanks David, I'd also add that as the Commissioner mentioned this morning, we've invested heavily in the recent past in our quality assurance program within our auditor or assessor workforce. We'll continue to do that, and it's supporting our consistency and those issues of variation that we've experienced and you may have experienced in the past. That's a really important thing for us, to exercise that continuous improvement in the same way we expect that of the sector. So.
Thanks very much, Anthony and David. Monique, I think this might be one for you. With the implementation of new expectations, e.g. food and nutrition, will there be a review of funding to support this reform?
It's a great question. I wish I could answer it right at this moment, so I might need to take that one on notice in relation to food. But look, we are doing a lot of different practices in relation to food and nutrition across the department at the moment, which is great to see that level of reform. But can't give you indication in relation to supported funding, I'm afraid.
Thank you. And look, I will just note that, you know, part of the way that we're helping the sector to get ready for the reforms is through the engagement and education program that we run in the Commission. Janet spoke about our role in supporting the sector this morning, and we do take that very seriously. In the food and nutrition space, there's a lot of content there for providers, and we are excited to be partnering with the Department of Health and Aged Care in the new free mealtime and menu review, which will involve, for those people who want to enjoy that opportunity, it gives you the chance to get an accredited dietitian to come out and review what's happening in your service and in terms of meals and mealtime arrangements. So something to watch out for. There's quite a bit of content on both the Commission's website and the Department website on that program. Our next question. For large organisations with 40 plus homes, interviews with governing bodies for each site audit would be challenging. How do you anticipate this to be achieved effectively through the audit process? Sharayne?
Thank you, Lisa. Absolutely. In the design of our methodology, we've been really conscious of the impact of our approach on small providers, medium providers, large providers. So we have been testing our approach and how that would work for a provider of that nature with quite a few homes. We are also testing what that scale looks like in terms of, as Lisa mentioned, the on-site component versus the off-site component. So I don't have a clear answer today because we are still undergoing our testing regime to get this right. Thanks.
Thanks, Sharayne. But I think if I can add to that, I think the bottom line would be we seek to gather provider information once, if we can. So I don't think there's an expectation that we would be meeting with a governing body for the site audit of, for a large provider for every site audit. I think we would be envisaging meeting with the governing body at the beginning of the audit process and not expecting to have to, repeat that for each of the residential service audits. Now, our next most popular question, and this might be one for you, Anthony, how is quality of care balanced with dignity of risk for residents?
Good question, thank you. It is something that we expect will look different for every older person receiving care. So under the current standards, as in the proposed standards, we very much have the older person in that framework in the centre of care. So that means having in place a really effective and frequently reviewed care plan that expresses their individual preferences and their own personal requirements, be it cultural, be it whatever it might be, certainly expresses it in an individual way, reflecting their individual needs. So balancing dignity of risk with quality of care is one and the same thing. I think that you're providing quality of care when you're meeting the individual preferences and requirements of that consumer, as we currently term them, or older Australian, and providing that care in a way that is clinically safe for them as well. So it will look different for every individual older Australian receiving care.
Thank you, Anthony. Now, our next most popular question, and Anthony, I might come back to you on this one. How confident is the Commission and why that the new standards will improve care and experience outcomes to residents?
It's probably a continuation of that previous response. I think it's, in watching your presentation this afternoon, Lisa, it struck me how the continuity of the older person in the centre of care is as much a feature of our current standards as it is in the new standards. But the new standards go so much further in terms of expressing those human rights and in terms of expressing the dignity of each individual who is receiving care. So putting that person in the centre of care is very much an an enhanced feature, if you like, of the new standards. And the new standards talk not just to human rights, but also to cultural safety. And cultural safety is not a concept that just applies to a particular cohort of individuals, but to all people, regardless of their background. They have a right to expect that services are provided in a way that meets their individual preferences and are therefore culturally safe for them.
Add something. I just want to add something to that, Lisa. So in designing the standards as well, something which we made a big effort to look at was measurability, which is something the Royal Commission wanted as well. So the standards have been designed in such a way that it should be easier to measure, and then also the clarity around the standards was significantly improved as well. So providers should hopefully have a better idea of what kind of standard they're trying to meet and what the expectations behind that are when they're being audited by the Commission.
Yeah, thanks, Monique. That's a really important
I might comment on
observation.
that as well. Yeah, I think also looking through them, there's a massive piece on risk management through the whole piece, and however, there's also a level of proactivity that providers needs to show for the resident, and I think that piece in itself, we're going forward into the world where there is more rampant consumerism. That's going to be really important, and the communication piece with residents and the families is vital, and I think that does get picked up really well. It's not mentioned overtly in the material I've seen, but certainly when you look at the questions you'll be asking the older person, there is a health literacy piece for providers with their residents. Have you been explained this? Now, those sorts of questions, they're the things that providers should be talking to their residents about as to why they're doing things, and do they understand the impact of, say, the care they're being given or participating in a health and wellness program. And particularly when you're dealing with isolation within a home, because we know some residents don't want to go to the dining room, and how do we deal with that? And, and so I think there's a whole range of health literacy built into parts of it without saying those words. And I think that proactivity in there, I think will certainly assist providers in getting the improved outcomes.
Yeah, thank you, David. Really helpful insights. Our next question asks, you've mentioned provider-level meetings to meet and interview governing body members. As a small not-for-profit, our board are all volunteers and work paid jobs elsewhere. How does the Commission propose to meet board members in circumstances like ours? Sharayne?
Thank you. Yes, so in terms of our planning, as you identified, Lisa, in your presentation, the first step is to connect with the provider and set out the plan for the audit, and that includes setting up relevant meetings. There would be flexibility, depending on your board, to be able to negotiate an appropriate meeting time to connect, to plan, to then be able to proceed with the remainder of the audit.
Lovely, thanks Sharayne. And our next question is a related one. Will the opening meeting be before coming on site, or as before within a period of time of arriving on site?
Generally, the approach that we have been testing has been a combination of on-site and off-site. So at the provider level, a connection to start the audit planning, and then an entering meeting, if you like, for the on-site component. But there would be, at the initial opportunity to connect, to be able to do that off-site or remotely.
Great, thank you, Sharayne. Our next question is, for public sector providers, is there consideration of mapping of state-based regulatory frameworks so that we can minimise duplication of audit? I might ask Monique to start and then perhaps pass to Anthony.
So I might just build on something we talked about in the previous session just around MPS providers. So with MPS providers, they need to meet requirements in relation to healthcare. They also need to meet the standards as well. And as part of the work of the fantastic healthcare regulator, they're actually doing a gap analysis now to work out the deviation between those two standards. They'll then update the MPS module as well. That way they're getting audited. MPS providers will be audited through one process for both the standards and for the healthcare standards as well.
Thanks, Monique. That sounds very encouraging. Anthony, have you got anything to add to that?
Just to add to that, yes, for the new quality standards, all providers, including public sector providers, will be required to meet those, including outside of the MPS program. But as Monique said, we've been working closely with the health regulator in terms of the design of Standard 5, so there's some consistency there.
Great, thank you. Our next question is, as part of the audit methodology, is there any consideration for information requested by assessors during the site visit to be reviewed digitally rather than requesting to print paper copies of many documents? Sharayne?
Yes. Definitely there is. And I think once you experience the new methodology, you will see the changes in the approach. So the first step is that request for information, and so there is an opportunity to do things quite differently to your current experience, where many documents are pulled together in your first few hours of the assessment team being on site. So the RFQ process, the RFI process of collecting information is the start to that, and an opportunity for the assessment team to review that information before they actually arrive on site. So there are some efficiencies, and you'll see hopefully some really positive impact on the time it takes to participate in the audit on site. In terms of the actual logistics of where to put information and how, we're still working through a broader plan around our IT systems and opportunities to connect information rather than through email or other sources.
Thanks, Sharayne. So I hope that's reassuring for people to hear. Our next question, Anthony, I think this might be one for you. When do you think the audit methodology changes will commence, assuming it can occur prior to the enactment of the new Act?
Thank you. A similar question was put to the Commissioner this morning, and the new quality standards will come into place when the new Aged Care Act comes into place.
Thank you, Anthony. So please send through some more questions. I feel like I've exhausted the ones that I have in front of me on the screen, although we do have another couple of other suggestions up our sleeves. And Monique, I might ask this one of you. So we understand that the new Aged Care Act is focused on the rights of the older person. How do the strengthened standards seek to support the older person's engagement in their care?
Thanks, Lisa. So for Standard 1 of the Strengthened Standards, it underpins the way providers and workers are expected to treat older people and is relevant to the application of all of the standards. So Standard 1 directly links to the Statement of Rights by reflecting important concepts about the person-centred care, around privacy, dignity, respect, older person's individuality and diversity, independence, choice and control, culturally safe care, and dignity of risk. As we can see, it's a very important standard. These are all really important in fostering a sense of safety, autonomy, inclusion, and quality of life for older people. So to emphasise the importance of the rights of the older person, Outcome 1.2, Dignity, Respect and Privacy, requires providers to demonstrate they understand the rights of the older person set out in the Statement of Rights and has practices in place to ensure they deliver care and service consistent with those rights being upheld. It's also expected that the key concepts under Standard 1 be incorporated into every other aspect of the older person's care across the standards, whether that be clinical care, food and nutrition, or care assessment and planning.
Lovely, thank you, Monique. And do please keep sending your questions through on the app. I might just ask my technical folk to just have a look at this and see if it's user error on my part. But in the meanwhile, a question for Anthony. Will there be a grace period for organisations to get up to speed with the new standards and educate their staff once the standards are in place? Or are we expected to have everything, so policies and so on, in place from day one?
We don't have any latitude to provide a grace period under the legislation. When the legislation comes into effect, we will be regulating it from day one. But where we do have latitude is in our response to non-conformance that we find when we're with a service provider. So we're through conferences like today, through the guidance material that Lisa pointed to, through the preparedness that opportunities that are available for providers, we know that there is a lot of material that is available, that will be made available to you to support your transition to the new quality standards. So we do expect from day one that you'll be ready and that you will have these processes and systems in place to demonstrate your conformance with the new standards. But as I mentioned, in terms of our working with a provider and identifying non-conformance with those new standards, we'll take a proportionate approach to what we find when we're on site or working with a provider at a provider level, which means that we may determine that we can see evidence that you are putting in place those systems and processes to demonstrate that conformance with those new requirements. And that might inform a decision maker to determine that there's a lower level of risk associated with that non-conformance. Alternately, where we find that there is a persistent non-conformance or an unwillingness to conform with those new standards, then through that those tiers of supervision that were outlined this morning, we may respond to that. But the key message is take advantage of the resources that are being made available to you to be prepared for implementation, and we will be certainly continuing to provide the levels of resources that we're providing today.
Thanks very much, Anthony. Sharayne, perhaps one for you. The new standards outline the need for competency-based learning for staff. What will this look like and what evidence will be required?
We've been looking into this in terms of our pilot activities, our pilot assessments, and this evidence of compliance with this requirement can take many different shapes and forms depending on what provider you are, where you're offering your services, and your consumer base. So we are looking for competent staff that are able to perform their duties, that are well trained, that have appropriate briefings and good awareness of the consumers that they're working with. But it's very hard to articulate that in a precise way. We will have information in our guidance to support you in the many different shapes that takes. Thanks.
Thank you, Sharayne. And a related question. Given that implementation, both within the Commission and providers will all be at varied levels of understanding, will there be support during the transition for your team and providers while we all acclimatise? That's a great question. I might take that one. We're working really hard on that. So we've got a program underway at the moment which we call Reform for Better Aged Care, and that program is really all about getting everybody ready for the changes. So for the Commission, for providers, for aged care workers and for older people. So within that program we're doing our best to kind of think ahead to the sorts of things that we can do to support providers. We'd really value your feedback. It's been great, the people that have engaged in our public consultation feedback. I've got some questions for the group towards the end of the session about what else you might like to see from us. You know, how else can we better support you? And as I said, we are trying to take an approach that recognises the diversity of the sector, both in terms of the nature of the people you care for and your workforce, but also in the capability and experience. So we're trying to deliver a range of materials for, you know, a whole set of different audiences. And I think you've just also heard from Anthony the approach that we'll take in a practical way in terms of assessing performance. So where we can see that providers are fully engaged with this, they're doing their darndest to get their They might not be quite there yet, but there's, we're not seeing significant risks to people are receiving safe quality care. Then our response to that will be, to applaud your efforts and to encourage you to keep going. But where we see that people aren't engaged, then our response would be different. Our next question, this is a beauty. How would you determine the accreditation status for each facility? To clarify, if one facility has non-conformance, does that impact on all other facilities' status under the same provider? Sharayne.
Okay, so just to recap, Resi Services will receive one audit per service. So that is the Category 6. And so that may result in, it will result in a conformance rating. That may result in non-conformance. That is found at the service level, but the actions taken may be or would be at the provider level. As Janet mentioned in her opening session this morning, the Commission is introducing a supervision status, and that status will help inform what actions the Commission takes and how we monitor a provider. So some of those actions may result in provider-wide arrangements. In other cases, it may be a plan for continuous improvement at the service in relation to the identified non-conformance.
Thanks very much, Sharayne. Now, a question here, which I'm not sure we can answer. There might be one of my erudite members of the panel might be able to go there. There's a new term called positive risk, and this term is used in a couple of different ways, yet not included in the definitions or glossaries. Can you describe this further, please? Not sure if that's one we'll have to take on board. I think we are universally looking bewildered, but thank you to the person that asked that question. We'll follow it up and see what we can find out. Our next question is, do you see in the future NDIS and aged care working more collaboratively together to eliminate the requirement for 2 separate commissions and 2 audits? So I might start the response to that, and then others might want to chime in. So one of the things that the government is, I think, keenly interested in harmonising as far as possible, as we make sense to do so, across the care and services sector. And we've certainly been informed by the approach of NDIS in the Aged Care Code of Conduct, for example, follows the NDIS version pretty closely. We also gave consideration to that in the construction of the strengthened standards. So I think the answer is we are looking for where there are opportunities and it makes sense for us to bring things more closely together where we are doing so. Whether we will reach a point in time in the future of not having separate commissions, I think is a very exciting question for government. Did you want to add anything to that?
Just supporting exactly what you're saying, Lisa. Look, from a departmental point of view, we're certainly looking to what the NDIS is doing and looking at where there is opportunities for harmonisation wherever we can. And just as Lisa mentioned, in relation to how we've structured the standards, they do mirror the same structure as the NDIS practice standards, but obviously have been realigned to the aged care setting, which is a very different setting from disability.
Lovely. Thank you, Monique.
Lisa, can I add to that too, for the immediate future? We know in those provider level meetings that are part of the new audit methodology, it's really important to have outlined to our team that a service is operating against a number of those regulatory requirements. And we've heard that in the round tables that we've conducted, particularly in relation to First Nations services, that the Commission having that awareness of those varying models under which a service is operating is really important for us to understand the context in which a service is operating. So it's a part of our picture of you as a provider.
Thanks very much, Anthony. Our next question and this might go back to you, Anthony, previous assessment methodology did not seem to credit services with identifying issues and applying remedies themselves before assessors visited. Will this be more of a factor in the new arrangement?
We certainly, under the current methodology, encourage providers to use the continuous improvement template and to identify the activities that actions that are being taken in relation to continuous improvement. And we expect that will continue under the new audit methodology as well. So we'll be looking to providers to tell us how you are understanding risk at a provider and at a service level, and what are the actions that you're taking to remedy that risk or to treat that risk. That is going to be a continuingly high-profile aspect to our methodology, and the Commissioner this morning outlined those detect, remedy, treat, respond, thank you, aspects to that new framework.
Thanks very much, Anthony. This is an interesting one, I think perhaps for Sharayne. Will a finding of non-conformance be the same as ISO and NDIS? That is, where 3 minor non-conformances automatically become a major non-conformance?
Oh, I'm not sure that I can answer that. In terms of the finding, it would be of non-conformance, it will be at the outcome level and the standard level. But in terms of adding them up and it equaling something, no, that's not part of anything that we've been testing.
Thank you, Sharayne. And a question for providers that deliver across multiple registration categories, will the audit cover all categories at the same time? And yes, that's the intention. So the idea is to have one provider level audit, one provider level audit, which would encompass categories, services in categories 4, 5 and 6. So we'd be looking for the provider level, collecting that provider level information, and we would be using a sampling approach to test the care and delivery of services in home settings. And as you've heard, we would be auditing each of the residential services. Okay, what is the proposed duration of audit, recognising current audit schedules? Sharayne, do we know yet?
It's so, I feel like everything you ask me, I say, I can't answer that. It's really hard to say because as we've spoken of with the methodology, we are looking to collect once at the provider level and then use that information for each of the audits. So if you are a provider with multiple residential services, the duration may be different for each of those sites, and the request for information process bolts on at the front end. At the moment, with our pilots and testing, an audit is taking around about 5 days in total. Thank you, David, for your comments on the report process. We absolutely expect the report preparation and the delivery of that preliminary report to reach you much faster than you are currently receiving.
Thank you, Sharayne. And as we said, as we finalise our trial audit program, we'll be looking to build our anticipated timeframes into our audit methodology document and making that available to everybody, so you'll have that clarity. Okay. Traditionally in residential aged care, it's believed that the assessors spend more time on the floor observing practices, talking to staff and residents. With the new standards and auditing process, will that change? Sharayne or Anthony?
Sharayne will join in, I'm sure, if you've got more. The new audit approach will require an auditor to spend time on the floor, talking to staff, observing practice, and importantly, talking to older Australians receiving care and their representatives. So that won't change. But what will change will be how we are targeting the people that we sample, and that's a feature of what we're testing in our second phase of the field testing right now, that sampling methodology that we apply. Sharayne, do you want to add?
That's right, and similar to our current processes, there are opportunities for any consumer to reach out to the Commission and provide feedback at any time. So it's not time dependent on feedback must be within, a month or two of the audit. Feedback can be provided at any point across the year.
Lovely, thank you, Sharayne. Can a board meeting be via Zoom where board members are scattered over Victoria? Yes, is the answer to that. Somebody has written to say that they're keen to find out more about the approach to auditing remote or First Nations services that the Commission's adopting, a very important issue for remote standalone services and recognising different cultural and geographical contexts. To the person who raised that question, please get in contact with us. We'd love to chat to you about the work that we're doing here. We're really keen to get this right, and if you'd like to be involved, we would absolutely love to hear from you, so please do get in touch. I'm going to go back to David at this point and ask him to reflect a little bit on what you're doing, David, to prepare your service for the changes, and I'd love to hear from you on what more could we do at the Commission to help.
Sure. We've got a project plan in place. When we look through it, we believe there's a lot we're already doing in there. It's probably more how do we have to reframe any processes at all. And I think just as advice for anyone looking at it, regardless of what size you are as a provider, have a look at the new things and just, because this is about getting evidence, and just, as a start, look at the new things that are required and say, okay, what evidence do we need for those new pieces of information that we're going to have to verify? So that's a really good starting point for the new bits. And then obviously where you've got standards that are aligned or clarified, again, probably in a second or third order, be looking at, do you have to adjust any of the evidence that you're providing for those alignments or those clarifications? That's how we're approaching it in our project plan. But saying that we're looking through it, we're reasonably, we were gathering a lot of information that you're asking for already within and reporting that, but it's how we frame it to the Commission. That's really the essence of our project plan. In terms of what the Commission could do, I think it's for on the ground, when you do receive a visit, it's again, it goes back to when I hear the room, it's usually always just around the consistency and how does that play out. Now you're going to be in a new world of a new audit program, and even instances like this is consumer focused. I don't like using the word consumer, by the way, but anyway, it is what it is. But when you're looking at you're asking a resident, and we have had some times in the past where, particularly around a cultural issue, where it's assumed because someone's of a certain culture they want a cultural-based service when they don't, and it's required a bit of pushback. So I would encourage also, from an advocacy point of view, if you're a provider and that is the case and there's a bit of a misreading of what the consumer wants when you're doing an audit, to kind of work with the auditor to try and explain that as well, because, they may not, for different reasons, want that type of service just because they're Indian or just because they're ATSI. So I think that's something for you to be aware of when you're learning, particularly for the assessors, because we have found that to be the case. It's almost like a stereotype around a culture, and therefore that's the consumer outcome. When the consumer's actually said, no, I don't want that, they need to listen, because that's the whole purpose when you're going in there. So I think that'd be my biggest piece of advice, other than the information you've provided so far is is quite in depth and quite amazing when you look at the packs that you're doing. Almost information overload, isn't it? It's really good, and I think that information source is a really good basis to be able to refer to that for operators. So I applaud you for what you've done so far, and I think what you're doing to try and help providers around how they gather information will be useful going forward. So it's probably just listening to what a provider's needing or missing out on in information, or can it be truncated or whatever, because there is a lot of info there, and if you're a single site provider or God bless the regional providers that really struggle with day-to-day operations, how can we help them as an industry to get up to speed with the new standards? And I suppose I encourage them that there is a role probably for the industry body, and encourage those operators to also contact the department, establish relationships, and use those industry bodies as well. Because if you look at something, say, like evidence-based practice, how do they keep up with that? We might have an in-house researcher, but, ACPA could certainly be a source of help there for those sorts of things. So it's a two-way street, but I think you're doing a lot of information provision and preparing. So in a way, the way we look at it, there's kind of no surprises, but there's a lot in it. It was big and a bit scary when you start developing a project plan around each standard. It can be overwhelming, but on the whole, there's a lot of good things that operators are already doing, and this is just kind of improving all of that.
Thanks very much, David. They were really interesting reflections to hear. I wanted to finish the session by asking a couple of questions of the room, if I may. So if I can ask you to go to your conference app, I wanted to ask you and you'll need to access the Mentimeter via your conference app. But what we'd love to ask you is, how can we improve our resources? What else could we do to improve the resources that we have available? We'd love to know. So please jump on Mentimeter and tell us what you think. And while we're waiting for those comments to come up, I will just go to a couple of other questions that we had remaining. One, a really interesting question about governance. Do you expect board members in small charities such as ethnic-specific providers where English is a second language to have the same understanding of governance as large providers? Well, we want to do everything we can to help boards of that sort understand their accountabilities, because regardless of being voluntary and their situation, as the governing body, they are accountable for what happens at the service. So one of the things we'd be interested in hearing from you is, how can we better how can we better assist boards of that type? So we've got content that we're delivering for governing body members, and it's something that we'll give some thought to I mentioned our COLD project that we have underway, but it's probably just as relevant to small providers and regional providers, where we know we often see a lot of community boards. So, oh great, so we're starting to see a great range of suggestions. A to-do list. Wonderful. Our team will be thrilled. I'll be taking this home with me. So thank you, everybody, for all of that, and thank you for all of the questions, including those we haven't got to. We'll be taking all of that into account as we continue to release information on the strengthened standards and the other reforms that are coming our way. So I do want to close by thanking our panel, who I think have been terrific. Thank you to David and Anthony and Sharayne and Monique. You've been great. And thank you to the audience for all of your questions. It's been, from our perspective, a really interesting and stimulating session. We've really enjoyed it. So you can now enjoy a well-deserved break and some afternoon tea out where you found lunch. And please do join us back here at 4 o'clock for our final session of the day, which is a great one to finish on, to hear from your colleagues about how they're preparing for the reforms. Thanks very much, everyone.